Hi, my name is Adrianne Strachan, and I'm with the Chicago School of Professional Psychology at Xavier University of Louisiana. Today, I'll be talking about improving inclusivity of sexual minorities in healthcare. The purpose of this research is to bring awareness of the stigma and discrimination that this population deals with and the effects on non-inclusive healthcare. Those who identify as sexual or gender minorities, 1.5% are more likely to suffer from anxiety and depression. Those who identify as lesbian women are 3 times more likely to have alcohol or substance use disorders. Those who identify as gay men are more likely to develop substance use disorders. 40% of transgender adults have attempted suicide. As healthcare providers, we must not be among those who contribute to the stigma and discrimination that this population already feels. When it comes to physical health, they have increased health disparities, such as HIV and cancers that are worsened because of the fear of discrimination and stigma that comes from healthcare providers, in which it takes them longer to seek services. There are many barriers to treatment as to why members of this population will not seek healthcare. Those things include the stigma and discrimination, and those can appear in structural, interpersonal, and individual different ways, or access to healthcare. So not being able to get healthcare due to policies that prohibit same-sex insurances. Finances might also play a role in the lack of access to healthcare, and not many insurance plans for some of the things that accommodate some of the things that this population would deal with. Another fear is the lack of training. So within the healthcare professionals, so learning things such as sex versus gender, using affirmative communications. And they often are mistrustful of healthcare providers, in which they have fear in which they fear discrimination and not being treated like others. For best practices and interventions, there are many different things such as structural, interpersonal, and individual things that we can do as healthcare providers. Changing the environment, and including things like gender neutral bathrooms, updating intake packets to include more options for sexual and gender identifications, and using affirmative language throughout the healthcare staff and the administrative staff. Changes in policies and practices to reduce stigma and discrimination, and provide material and waiting rooms that apply to the population. Individual and interpersonal interventions include cognitive behavioral therapy to help deal with discrimination and stigma that this population deals with. Further direction and recommendation. Education is at the #1 thing to educate those who are going to be working with this population on how to make them more comfortable in the environments of health and in the environment of healthcare. They can incorporate curriculum within the medical in medical school, nursing school, and any other healthcare schools. So it is not enough to be culturally competent anymore. So it's not enough to just know about the population, but it also requires cultural humility, which is a lot of introspection on the provider's part in order to treat this population. The 5 R's are a great way to incorporate these different things in order to become a culturally humble healthcare provider. Here are further references to address and look at while to hopefully provide more inclusive healthcare for sexual and gender minorities.